Hi, this is Anthony with the Fascianator, and today we're going to show you some easy chair techniques you can do at home. First, we're going to start with your feet. Now, when rolling your feet, whether you're sitting or standing, make sure you have some kind of grippy material like a yoga mat or a nice little rug. Now, first thing is the bottom of your foot, also known as the plantar fascia. Now, what you want to remember, there's three pieces: a middle one, an outer one, and then the aponeurosis, or the sheath in the middle. So watch, I simply take my Fascianator, place it on the floor, and while I'm sitting, put my foot on the roller. I'm going to angle the foot inward a bit, and yes, I'm just going to push back and forth. And once you feel those cracklies, you'll be able to feel how it goes nice and slow up through the center, the inner arch of that foot. Now, lean out. Tilt the foot outward. Roll that lateral plantar fascia. Very easy, very safe. The more you can take care of yourself, the better. Lastly, we're going to go into the middle of the foot and through the sheath that connects those two arches. And as you roll this out, you can start to feel the little crackly sensations. What's happening is breaking up inflammatory waste and water is flooding in. That's it. So the next body part that we're going to work on is the calves. That's the back of the lower leg. Now, it's very easy, but you might need another chair in order to get your leg up there. This is so if you can't get on the floor, you're still able to roll your calves, which in fact acts as the second heart. So it's important. We pump that old fluid away from those calves. The edema, the swelling goes down. The pain when walking goes down. You ready to try? Easy. Take the roller, your Fascianator, place it right on the chair. Now, you can put your first leg on the calf muscle on the roller, and what I like to do is cross my top leg on top of my other leg, and I just add a little pressure left and right. I'm going slowly. If I want to move the roller a little bit further down my leg, same thing. To use my foot, push it down, turn left and right. All right, very simple. The next body part in the lower leg is the front compartment, or also known as the anterior compartment of the lower leg. This is how we can help prevent those shin splints. We can also prevent tarsal tunnel syndrome. It's very simple. Take your Fascianator. Along the outside portion of the front of your leg are muscles. Very easy. You push down and you go back and forth. Now you might be wondering or asking, well, what if I can't bend down that low? We got an answer. Put my leg up here, and that way you're not bending lower, but you're still able to reach that body part. Easy. Okay, perfect. Now, the next area, still in the lower leg, is actually this muscle group here. It's called the fibularis muscles. And you want to make sure you don't hit the bony landmark at the top where that muscle is attached, nor do you want to go past about 4 or 5 inches below the knee. It's very easy. You take your roller. I like to press down nice and slow and feel what's happening. And remember, if it's tender, then it's tight. All right, you free this up. This helps with tendonitis in the side of the leg. It can help improve your lateral stability of your ankle, because if these muscles are tight, you will have a higher tendency to sprain that ankle, as well as it pulls the toes out and causes what we call banana calf. Don't want that now, do you? So, now we can finally move into the upper thigh. We're actually doing pretty good here. How are you guys doing at home? Good? Good. Well, we're going to do the back of your leg. 3 muscles in the back of your leg, known as the hamstring. I'll tell you the 3 names later. You're going to take the Fascianator. You shall place the Fascianator on the edge of the seat. Place your thigh on top of that roller. After you do that, you can hold on to your roller or hold on to your seat. But the trick here is just to move your leg left and right, your femur left and right, while pressing into it. You'll feel those bumps as they come to the surface. Bump, 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 bump. Perfect. Now we're moving right into the inner thigh. The inner thigh, also known as the adductor muscles, comprised of 5 different muscles. They attach up here in the hip and they go all the way down here past the knee. Now, what you're going to do is take your roller, you can extend your leg out, and remember, you're trying to focus by putting a little extra pressure on that inner thigh. I like to hold the ends with my fingers and press down, and I can feel, you see on that leg, doink, you see how it just moves a little bit faster? There's a little knot there, and you just move that back and forth, just like you're kneading dough. You can also go back and forth this way as you come down the leg. Again, if it's tender, it's tight, you'll know how much pressure to put. Don't be afraid. Now we're moving right into the front of the thigh. In the front of the leg, there are 4 muscles. That's why it's called the quadricep muscle group. Now, these muscles are all here. So we're doing this chair situation because we know a lot of folks at home, they sit in chairs a lot. And the longer you sit in the chair, this muscle shortens. It actually pulls your pelvis forward. That can put pressure on your discs. That can put pressure on the nerves coming out of your spinal column. So we want to help you avoid that, right? Easy. I like to extend the leg out. The reason we extend the leg out is you want it to be loose and not working. I want that leg relaxed, and I can press down. I like to go up through start at the top of the hip and press down through the middle first. Take your time. You got a couple of half passes. When you start finding tender spots, go, oh, there's something. You pause there and you look around a little more. Now, after that, angle the roller to the outer edge. I'm not rolling the all extreme thigh on the side. I'm rolling about 30 degrees angle outwards. I angle it. Oh, you might notice it's a little more tender, isn't it? Yep. This is a bigger muscle. It has a tendency to do most of the work. So instead of letting it overpower, we're trying to neutralize those imbalances. And that's going to help your kneecaps move like mine. Thanks. So now we're going to roll into moving into, cancel. So now we're moving into the glutes, or what we sit on all the time. Now, if you notice, we brought in the big chair, and we also have your standard chair. So if you're at home and you have a bigger chair that you want to feel more comfortable in and more balance in, then I'll show you how that works. And after that, we'll show you how we can do it. Let's say you're in a community center, taking the class, a rolling chair class, and you want to get to only have these chairs. Well, we're going to have that example for you as well. All right, so why don't we start with the first chair? It's going to be this big red one. Now, when we roll the butt, we're not trying to roll it down here. We're trying to roll it a little bit higher, more towards the waistline. And what I'm going to do is place the Fascianator on the chair. And first thing I'm going to do is sit on it. Now, you might want to put one arm over the back of your seat and put your feet a little bit in front of you. And as you're leaning over, you're just feeling around for the tender spots near your hip and your butt. All right, great. Okay, so like we said, we're going to show you with the big chair that you might have at home, and now we're going to show you with the chair you might find at your standard community center. So again, I take the Fascianator. Now with this one, you got to make sure it's in there stable, or at least make sure you're stable, and make sure that your feet are planted flatly on the floor and wide, so you have that stable platform. Now, I place the roller on the seat. I'm just leaning out a little. Maybe I want to come out this way. And there it is. I can feel those little tender spots under my butt. And those are my deep hip rotators. And this is what helps you prevent sciatica. So now we're moving into the upper body. And a couple of things we can do when we're focusing on the back muscles. What we're going to do here is show you how you can place the roller vertically. Now, I will adjust this seat so you can see, get a good view here. And all I'm going to do is put that roller right up and down, not right on my spine, but in between. And all I'm going to do is lean back and forth, and I'm looking for those tender spots through my spinal muscles. All right? Great. All right, now we're moving into the upper body. We're still in our community center chair. We're going to take our Fascianator and place it in between your shoulder blade and your spinal column, right smack dab in the middle. And what you're going to do, take this roller, Place it up and down, vertical orientation. And I'm just leaning back, and I can just go left and right on the muscles in between my shoulder blade and my spinal column. Now we're moving right into our chest muscles. First thing I want you to do, take your fingers here, feel your collarbone. Now, take your fingers after you find the collarbone, push another inch below it. Feel all that tender tissue? Well, we're going to roll out those tight chest muscles using the edge of your fascianator. Place the edge under the collarbone, and you're using your opposite hand, pulling that edge into your chest while pushing left and right. Ooh, that's kind of tender. How's yours? All right, now into the upper extremity we go. This is the tricep, the back of your arm. Tri means there's 3 pieces. When this is tight in conjunction with tight forearms, you might be presented with golfer's elbow. So how do we rectify that? You're going to take the back of your arm. You're going to place it on the roller right by the elbow. You see that? Right by the elbow. From here, I'm just going to go back and forth. Now, this coffee table is a little low. Maybe you want to do this on your dining table or your kitchen counter. It doesn't matter as long as you have a flat surface and you can have access to rolling the muscles in your upper extremity. All right, now we're moving into the upper extremity. The back of the arm is the first area we're going to focus on. This is called your tricep. Now, when this is tight in conjunction with tight forearms, you can get golfer's elbow. How do we take care of that? Well, I'm on my table. I got my chair. I place the bottom of the elbow right above the elbow at the roller's edge here. I'm going to turn my thumb away slightly, and I'm going to roll up and down through the back of my arm. You will feel more blood start rushing to your hand. It's a really great feeling. This is also what helps with neuropathy and all kinds of other issues. Now, after the tricep, we're moving right into the bicep. That's the top of the arm. It has 2 pieces. One that goes under the collarbone and attaches to your scapula. Another one that goes up through a groove in your arm and into the shoulder here. Now, the other place that they end up attaching is on the thumb side, or the radius forearm bone, right at this spot right here. So this is what gives a lot of people that tennis elbow. And they're rubbing and it hurts. So how do we take care of those? Well, first thing, we're going to start is by rolling that bicep. I place my arm flat on the table. Take the top of the roller, and my other hand is on top of my bicep. From here, I'm just pushing down while rolling. Make sure the bicep is facing the ceiling and you're not rolling the inside of your arm. Rotate that upper arm if you have to. Press down and roll back and forth on your biceps. If I want to do the other side, same idea. You get a different angle here. Make sure the top is facing the ceiling. Your other hand is at a right angle, so you can push down on the bicep, being sure to look for tender spots in your bicep. Great. Now, after we finish the upper extremity, we can get into the forearm muscles. So in the forearm muscles, you have the extensors and the flexors. First, let's work on this top compartment. The way we do that, I'm going to take the arm that I'm going to roll. I turn my thumb all the way out so I can actually get pressure on the outside of that elbow where these muscles are pulling. As I take my other hand, I'm going to push down while my forearm is turned, and oh, there it is. Look at my middle finger. It's moving by itself. See that? I'm not doing that. I'm only putting pressure to free up the tension around the muscles that move those fingers. So if there's not a lot of tension, you shouldn't have a lot of movement. Some people, they'll roll these forearms and the finger goes, bang! So you'll find out. And yeah, it's tender. That means it's tight. Do not put that tender sensation in the pain box. All right? Great. Now we're moving into the forearm flexors. When these are tight, again, it can contribute to golfer's elbow, but more importantly for a lot of folks, it contributes to that carpal tunnel syndrome. And a lot of the people we worked with over the years, when they have that carpal tunnel, they can't put pressure on their hands. They're the ones who say, I can't get off the ground once I get down there. If we can help you bear more weight on your hands by these simple techniques, then in the event that you do fall, maybe you'll be able to pick yourself up instead of worrying about it, okay? All right, well, take the edges of the roller. You're gonna roll in between the ulna and the radius bone. So all these other muscles in here. Using the edges, I'm digging that edge into that forearm compartment, and I'm gonna walk it all the way to the elbows. Oh, and look at that. Watch my fingers curl. Now, look at them curling. And my right forearm, I can feel a little crackly sensation, tight muscles there. Okay? After a few moments, you will feel your fingers start to puff up with fresh blood and interstitial fluid. And after that, you'll be like, wow, I can really check it. It doesn't hurt. Wow, that's really good. All right, great. Following the forearms is the hand. Now, inside your palm, you have 3 muscles in the thumb side, 3 muscles on the pinky side, a piece of fascia in the middle, kind of like in the bottom of our foot. And when this gets dry, it can curl your hand in this formation. This is called a Dupuytren's contracture. Well, we have real stories. People with 20-degree contractures, we minimize them by 75% to only 5 degrees. And flash forward another year later, she's pretty much all better, all right? So how do we take care of that? Again, you're using the edges. I'm going to start at the pinky side of that palm, go through the middle, and into the thumb. So pinky, and as you walk that roller up and down your palm, it will feel gritty, it'll feel kind of crunchy, you might feel like there's crystals. This is great if you have arthritis to help break down some of those calcium crystals and give your body a little bit more mobility, a little bit stronger grip. Now, we got the top of the hand. We did the bottom. Let's do the top. In between your hand bones here are muscles called your interossei, and then you have all these other tendons from these forearm muscles that end up attaching on your fingers at various points. So what we're going to do is just keep all those tissues hydrated by pressing down on my hand bones, my finger bones, and you'll feel it. It'll make a little crunchy noise. Hopefully over time it won't be so crunchy. Now we're moving into an area in the underarm. This is where your lymph nodes are located. These are the lymph nodes that drain the breast. So it's important to clean this gutter out so the breast can drain their cellular waste. The other thing this is helpful for is getting blood to the whole extremity, taking pressure off the nerves that come out of the spinal column and go into the shoulder. When all of this tissue is tight, you might get things like peripheral neuropathy, thoracic outlet syndrome, frozen shoulder, and rotator cuff issues. So how do we do that? You're going to place the roller on the edge of the table, extend your arm out so it's in your underarm. From here, I'm just going to rotate back and forth. Remember, you might need to move around in your chair a little bit. Just make sure you're stable and safe at all times. When you find the tender spot, you wait there and just let the Fascianator do its work. Great. All right, we made it to the best part, or one of them, and that's called the neck area. This is your sternocleidomastoid. This is how we can help prevent with vertigo, tinnitus, Bell's palsy, visual acuity problems, and a whole host of other things that happen in the neck. What are we going to do? Lay your arm down this way. Take the edge of the roller and go as high as you can go. Take that roller. There should be no space between your neck and the roller. From there, I'm turning my chin to the ceiling, back and forth, looking for tender areas. And yeah, if you look closely, it's right behind the ear now, isn't it? Ah, feels so good. All right, next and last, we're gonna move right into what we call the suboccipital muscles. Now, there's 8 muscles under the base of your skull. They meet at that soft spot. I need you to find that bump, feel right under that bump. That's where those 8 suboccipital muscles are. Now, to roll those muscles, you take your Fascianator, You hold it right under that bump in the soft spot, and I'm pulling that roller and pulling my head back into the roller while turning my head all the way to the left and all the way to the right as best you can. This is how you get rid of those migraines, keep fresh blood moving into your skull, and a whole bunch of other nice benefits.